What is glaucoma? A disease of the optic nerve head caused by too much fluid pressure in the eye. Optic nerve damage. It's not an infection and not contagious. How does glaucoma happen? If a sink has a leaking tap, the water will flow through if the drainage mechanism is alright, but when the drainage is blocked, the water begins to collect. Same way, when the eye's drainage mechanism gets blocked, the fluid gets collected in the eye. As the fluid builds up, it starts to exert pressure inside the eye. How is glaucoma spotted? In the early stages, glaucoma can't be seen or felt by the patient. It's usually spotted during a routine eye checkup or discovered by the patient only after a certain amount of damage has already occurred. Damage appears as a gradual visual change and then loss of vision. Are there different types of glaucoma? There are two major types: chronic or open-angle glaucoma. Acute or angle closure glaucoma occurs as a result of aging. Painless. No warning symptoms. Progresses very slowly. Occurs suddenly. Progresses rapidly. Who is at risk? Everyone is at risk for glaucoma. But, it's more likely to develop in older persons. People over 40 years of age. Having a family history of glaucoma. Having physical eye injuries. Having diabetes. Using steroids for a long period of time. Wearing thick optic glasses from long time. How is glaucoma diagnosed? There are 4 tests used to diagnose and monitor the progression of glaucoma. Tonometry. Measures eye pressure. Gonioscopy. Inspects eye's drainage angle. Ophthalmoscopy. Examines optic nerve for damage. Barometry. Tests peripheral, side, vision. Is there a cure for glaucoma? When detected early, glaucoma can be successfully controlled to prevent further damage and thus preserve vision with eye drops, laser, surgical operations. Although glaucoma can be controlled, any already occurred damage can't be reversed. Periodic eye examinations are vital in controlling glaucoma. Can glaucoma be prevented? Early detection and treatment can help in prevention. Get glaucoma check as part of regular eye checkups. People at higher risk for developing glaucoma should have their eye and optic nerve checked every year or 2 after the age of 35. Everyone is recommended to get a thorough glaucoma check around the age of 35. At age 40. Then one every 2 or 3 years after age 40. Medications. 1. How effective is medication? Medications can work in 2 ways. Increase the drainage of fluid in the eye. Decrease the production of fluid in the eye. Medications can be either eye drops or pills or a combination of both, which can safely control eye for many years in most cases. Medication must be taken regularly according to the schedule prescribed by your doctor. 2. What about side effects? Medications may have some sort of side effects, which usually become less noticeable after a week or two. Side effects could be redness of the eye, mild irritation. Don't hesitate to ask your doctor about any physical, emotional changes that occur while taking glaucoma medications. 3. Is it okay to change medication? It's normal for medication programs to change. Type, dosage of eye drops may gradually lose its effectiveness and be replaced by a stronger version of the same drug or a different medication altogether. Having to change medication doesn't always mean that glaucoma has worsened. 4. When is surgery an option? Surgery is the primary treatment for acute glaucoma. It's usually scheduled for only one eye at a time. There are basically two different methods of surgery. Laser surgery. A laser is a tiny powerful beam of light that can make a small burn or opening in tissue. Microsurgery. A microsurgical instrument is used to make a tiny opening in the sclera, to create an artificial drainage canal. Helping your doctor will help you. Having diagnosed and knowing you have glaucoma puts you one step ahead of the disease. Together with your doctor, you can work towards protecting your vision in the years ahead. If you are a newly diagnosed glaucoma patient, get your IOP levels checked every week or month until they are under control. See your doctor several times a year for regular checkups, even when your IOP is at a safe level. Discuss with your doctor about concerns and questions you have and get more information on your treatment options. Make it a point to talk to your doctor about doubts and queries you may have, however minor they may seem. The 7 Commandments to Manage Glaucoma. Here are 7 basic commandments to help you manage glaucoma. I will visit my doctor regularly, even when I don't have symptoms and my intraocular pressure is under control. I will take my medication regularly as per my doctor's instructions. If I forget to take my medication, I will take it as soon as I remember, and not wait till the next scheduled dose. I will immediately report any unusual symptoms or changes to my doctor. I will always carry on my person an identification card stating that I am being treated for glaucoma. I will make sure I always have an extra supply of medication on hand. I will take care of my eyes and the rest of my body by maintaining an overall healthy lifestyle. How to open the eye drops bottle. Before opening an eye drops bottle, thoroughly wash your hands with soap and water. Read the instructions on the bottle. Inspect the eye drops and check the expiration date of the container. Gently shake the bottle or roll the bottle between your hands. Avoid harsh shaking. Remove the cap from the bottle and place it in a clean place. Avoid touching the tip of the container. How to use your eye drops. Step 1. Sit down and tilt your head back or lie down with your head flat and look at the ceiling. Step 2. Make a pocket in your lower lid by pulling it down. Step 3. Put a drop in the pocket without touching your eye with the bottle. Step 4. Close your eye and gently press your finger against the inside corner. If you're using 2 or more kinds of drops at the same time, wait several minutes before putting the next drop in the eye.